Have you ever noticed your dog drinking more water than usual? Or maybe peeing more often, even though nothing in their routine has changed? These small signs, which often go unnoticed, could be pointing to something more serious: canine diabetes. Yes, dogs can develop diabetes too, and understanding how this disease works is essential to make sure your best friend lives a long and healthy life. But don't worry, there's no need to panic. Today we're going to break it all down for you in a simple and straightforward way: what diabetes in dogs is, how to spot the symptoms, what treatments are available, and most importantly, how to prevent it. Stick with us until the end, because this video is packed with valuable information that could make a real difference in your pet's life, and maybe even in the lives of other dogs you know. What is diabetes in dogs? Diabetes in dogs is a condition that might seem rare, but it's actually more common than many people think. It happens when the dog's body can't properly regulate blood sugar levels, which can lead to a range of complications if left untreated. To understand it better, let's picture this. Sugar, or glucose, is one of the body's main sources of energy. For that energy to reach the cells, it needs help from a hormone called insulin, which is produced by the pancreas. In diabetes, this process breaks down, either because the dog's body isn't producing enough insulin, or because it's not using it properly. As a result, glucose builds up in the bloodstream instead of being used by the cells. This condition can be triggered by several factors, such as genetic predisposition, obesity, hormonal imbalances, or even as a consequence of other illnesses. The most common type in dogs is type 1 diabetes mellitus, which is caused by the destruction of the pancreatic cells that produce insulin. That means the dog depends on regular insulin injections to survive. There's also another, less common type called diabetes insipidus. It's not related to glucose, but rather to a problem with water regulation in the body. Even though the names sound similar, they're completely different diseases with different treatments. The most important thing to know is that with early diagnosis and proper treatment, dogs can live well, with energy and a good quality of life. And it all starts with information. So if you're here watching this video, you're already taking an important step toward taking better care of your pet. Most common symptoms. The symptoms of diabetes in dogs can start off subtle, but they tend to become more noticeable over time. That's why it's crucial for pet owners to pay attention to any changes in their dog's behavior or routine. One of the first signs that usually shows up is increased thirst. The dog starts drinking a lot of water, more than usual, and as a result, urinates more frequently and in larger amounts. This behavior can be mistaken for heat or increased physical activity, but if it continues, it's worth looking into. Another very common symptom is weight loss, even if the dog's appetite stays the same or even increases. This happens because, without enough insulin, the dog's body can't use glucose for energy and starts burning fat and muscle instead. You might also notice your dog getting tired more easily, being less playful, or not wanting to go for walks. Their coat may lose its shine and look dull, and small wounds might take longer to heal. In more advanced cases, diabetes can affect the dog's vision, leading to cataracts and even sudden blindness. This is a major warning sign, and often the reason why pet owners finally seek veterinary help. These symptoms, especially when they appear together or persist over time, are a clear indication that something's not right with your dog's health. The earlier the disease is identified, the better the chances of managing it and giving your pet a good quality of life. Diagnosis. Diagnosing diabetes in dogs starts with the pet owner paying close attention to the symptoms. Changes in behavior, like excessive thirst, more frequent urination, weight loss, and fatigue, are signs that something might be wrong. But to confirm the disease, a veterinarian's evaluation is essential. During the appointment, the vet will perform a full clinical exam and request lab tests. The two main tests used to diagnose diabetes are fasting blood glucose levels and a urine analysis. When a dog shows high blood sugar, known as hyperglycemia, along with glucose in the urine, called glucosuria, a diagnosis of diabetes mellitus becomes very likely. It's important to note that these tests must be interpreted alongside clinical signs. That's because blood sugar can temporarily rise due to other factors like stress, certain medications, or even after eating. That's why the vet might repeat the tests or order additional ones to confirm the diagnosis. The vet may also investigate possible underlying causes, such as infections, hormonal imbalances, or other diseases that could be contributing to the glucose imbalance. In some cases, imaging tests or hormone panels may be recommended. Early diagnosis is key to avoiding serious complications, such as diabetic ketoacidosis, a medical emergency that can be life-threatening. So, at the first sign of something unusual, it's best to seek veterinary guidance as soon as possible. The earlier the disease is detected, the better the chances of managing it and giving your dog a long, healthy life. Treatment. Treating diabetes in dogs requires commitment and ongoing care, but with the right support, it's absolutely possible to give your pet a long and healthy life. The main goal is to keep blood sugar levels under control and prevent complications that could affect the dog's well-being. The foundation of treatment is daily insulin injections. Since most diabetic dogs have type 1 diabetes, where the pancreas doesn't produce enough insulin, they need to receive the hormone externally, usually through subcutaneous injections. The vet will prescribe the most suitable type of insulin, the correct dosage, and the ideal times for administration, which must be followed carefully. In addition to insulin, diet plays a crucial role in managing the disease. The dog needs a specific diet with a low glycemic index, high in fiber, and with controlled carbohydrates. There are commercial dog foods specially formulated for diabetic dogs that help maintain more stable glucose levels throughout the day. In some cases, the vet may recommend a balanced homemade diet, as long as it's developed with professional guidance. Weight management is also essential. Overweight dogs are more resistant to insulin, which makes treatment more difficult. That's why keeping your dog at a healthy weight, with regular exercise and proper nutrition, is a key part of the treatment plan. Another important aspect is constant monitoring. Pet owners should observe their dog's behavior, track any changes, and perform regular blood glucose checks, as advised by the vet. Sometimes, insulin doses may need to be adjusted or the diet modified. It's important to remember that diabetes has no cure, but it can be managed. With dedication, routine, and veterinary support, your dog can live a happy, active life with good quality. What matters most is that you, as the caregiver, stay present and attentive, giving your furry friend the care they need. Prevention. Preventing diabetes in dogs is possible, and it starts with simple but important everyday habits. While some factors like genetic predisposition are out of our control, there's a lot pet owners can do to reduce the risk of their dog developing the disease. The first step is maintaining a balanced diet. Proper nutrition, with high-quality ingredients and the right portions, helps keep the dog's metabolism functioning well. Avoiding excess carbohydrates and offering fiber-rich foods can be especially helpful, particularly for dogs prone to gaining weight. Weight control is another key factor. Obesity is one of the main risk factors for diabetes. That's why it's essential to keep your dog at a healthy weight, which can be achieved through a combination of good nutrition and regular physical activity. Daily walks, playtime, and exercise suited to your dog's age and condition are great ways to keep them active. Regular vet checkups are also important. Even if your dog seems perfectly fine, routine visits allow for early detection of any changes. In some cases, the vet may recommend preventive testing, especially if your dog belongs to a breed with a higher risk of diabetes. It's also crucial to stay alert to any changes in your dog's behavior, like increased thirst, more frequent urination, weight loss, or fatigue. Catching these signs early can make all the difference. The sooner a problem is identified, the easier it is to manage. Prevention isn't complicated, but it does require consistency. With steady care and lots of love, you can protect your furry friend from this disease and help them live a full, happy life. Canine diabetes is a serious condition, but with the right information, attention, and care, it's absolutely possible to give your dog a long, active, and high-quality life. From recognizing the first symptoms to treatment and prevention, every step matters. And you, as the pet parent, play a vital role in that journey. If you've made it this far, it shows how much you care about your dog's well-being. And that's what matters most. With knowledge and dedication, you can truly change your dog's life, and maybe even help other pets around you. Don't forget to share this video with other dog owners. The more people know about canine diabetes, the more dogs can get the care they need and deserve.